I'm Colin Hung, editor at Healthcare IT Today, and I'm excited for this conversation about patient experience and that whole patient cycle. I'm joined today by Dave Dial, CEO of Jellyfish Health, and Nolan Hennessy, CIO and Vice President
at St.
Joseph Candler in Savannah, Georgia. One of my favorite cities. Thank you for joining us, gentlemen.
Sure.
So I thought we could start by talking about your definition of an ideal patient experience. Dave, why don't you start? How do you define an ideal patient experience?
For me, patient experience is really about trying to figure out from a health systems perspective how to make it as frictionless as possible for the patient to begin their interaction on their patient journey. So as they're starting to reach out to that episode of care, they need to find a doctor. How do I make that as frictionless as possible, right?
Nolan?
I like the word frictionless. I think I'm going to use that now, okay? But really, for us, about the patient experience is I'll coin it, sorry if this is copyright infringement, is kind of giving healthcare that same experience that Amazon gives us, that lets us quickly do what we want to do, when we want to do it, how we want to do it, and then make it frictionless, because I'm like an Amazon junkie, so I just make all these purchases and bring that same forward of service within healthcare.
And why is that important to have that kind of frictionless experience or that really positive patient experience? I mean, is there a sort of follow-on benefits to this?
Yeah, I think so, and I'll share with you two quick stories. One is my mother. She's getting older, and they don't understand, when they see a healthcare organization, they just see a healthcare organization. They don't understand all these, well, that is a different office, they're employed by somebody else. So she always was kind of baffled that she had to fill out all this paperwork every time she went in there. So we're trying to remove that so that you fill it out one time. And then another personal story is whenever I'm also a dad. I had two teenage boys, and we went to a physician's office and walked in, and they gave us two clipboards and said, "Here's two clipboards." And my 16-year-old looks at me and goes, "Dad, you're the CIO. You guys don't have technology?" And it was 4 pages, and they asked very similar questions. And then that was kind of the aha moment that, wow, we're still kind of in the 20th century era. So that kind of sparked an interest in me to go, let's go do something about this. So it's about making it easy so that we ask a patient, a customer, and we're having to transition in healthcare to change our vocabulary from patient to customer. And how do we serve the customer? And it's all about ask me a question, ask it one time, and then share it with everybody else. Similar to what Amazon does whenever I do a purchase, right?
There you go. Love it. No more clipboards.
No more. No, we're getting rid of the clipboards. In fact, our new facility is clipboardless.
I love it. Right. I love it. So Dave, why do you feel it's important to put a focus on this frictionless experience, this patient experience? Is there sort of any financial benefits? Is there follow-on benefits? What are you seeing?
There are obviously financial benefits if you think about it. As high tech was enacted and regulation has entered the marketplace. Reimbursement is driven by Medicare, is tied oftentimes to patient satisfaction, and now commercial payers have adopted that same concept. It's why all of us as patients receive a survey a couple of days after our visit, right, to give us an opportunity to let that payer or to let the government know how we felt about that provider. And a big component of that is patient satisfaction. So there is definitely that financial tie-in. But I think it's a little bit more than that. It goes back to what Nolan just said around consumerism, right? If you're thinking about a patient now as a customer and you're trying to provide a service to them, everybody knows in any industry, loyalty is the number one driver you're looking for, right? If you can get that repeat customer that wants to come back to you, you're obviously going to have a better financial outcome. And typically, I think even the MGA released a statistic that said that they were doing anywhere from double to sometimes 3 times as much revenue for a physician's office that actually had a loyal patient base than one that was going out every year trying to find net new patients, and recruit them to the practice. So it can have a huge benefit.
Do you think there's any benefit, Dave, in terms of not just for the patient, but for staff as well? Is there benefit to the staff to have a really good, seamless patient experience? Or is it all one-sided on the patient side?
No, there's definitely a component of it that is staff-based. It is obviously sometimes a hostile work environment for staff, right? You're dealing with patients who've sat in a waiting room for an hour and a half. They're mad, they're frustrated, and then that gets taken out on the staff, unfortunately, right? Yes. As Nolan mentions, a lot of times patients don't understand the complexities of healthcare, right? This is not a manufacturing setting where some somebody's just pulling a lever on a widget as something, moves down an assembly line. These are people, and in every day, those people are going to have different problems, different things that need to be taken care of. And so one might take 20 minutes, one might take 40 minutes, right? And it's a different kind of, processing of patients. And I think that a lot of times we get frustrated and mad as a patient, and then we take it out on that staff. So if you can remove some of that, if you make the process better, if you keep the patients, informed,
right,
give them the transparency about what's happening to them, you kind of reduce that.
Reduce the stress for everybody, it sounds like, yeah.
You really do, and a great example of that is we've all had that feeling of sitting in an exam room, right, with the door closed. You can hear staff out in the hallway, they're talking, and you're wondering if they've forgotten about me, and then you start looking at your watch because you're worried that you're supposed to pick up your kid at 2:30 from the school line, and are you going to make it, or all that anxiety and frustration then again builds up in the patient, and when that door opens, who do they take it out on?
Sure.
The provider or the staff, right?
Right. Nolan, what do you think? Is there follow-on benefits to the staff of having that seamless process or that seamless experience for the patients?
Oh, absolutely. I mean, it kind of echoes. We're kind of putting those wheels into motion now because we started using this technology in one of our practices. And we started seeing the immediate benefit, both on the patient side as well as on the staff. And nothing like real examples, right? So we were pleased that whenever they came in, the customer could register. We started out with just using them, letting them just register on the iPad. You'd go, hey, I'm checking in, which kind of removes that interaction at the desk because sometimes there's 2 or 3 people at the desk. It's an awkward moment, whatnot, and they actually enjoyed. I was wondering how they were going to feel when we took the desk away from them. But they're like, okay, I can go sit down. Well, that allows staff to continue doing what they're doing. But here's a real example, and I didn't think about this until I saw it in action, because think about this, a lot of times the nurse comes from the back and says, hey, Nolan Hennessy, or whoever, it might be a parent with kids, and they're like, come on back. Well, then they collect their things and whatnot. Well, that takes 30 seconds to a minute. And part of the Jellyfish technology, and everybody's always on their phone, okay? Sure. That's what they're doing. They don't watch television in the room anymore, okay? So I was sitting out there just kind of watching what happened, and I saw this guy, he gets a page, says, please come to the back, and he just kind of looks up from his phone, because this is day 1 go live, and he goes, it says for me to get ready to come to the back. What does that mean? And so he picks up his stuff, and he goes towards the door, and he goes, and he starts to ask somebody a question, and we couldn't have timed it any better. That's when the nurse came out and said, patient XYZ, would you come on back? He's like, oh, okay, I guess that's what that means. But think about that 1 minute saved, right? There's 4 providers who usually see about 25 patients a day. Think about that 1 minute, and you start doing the math. So it just streamlined the organization. And to Dave's point about, I'm sitting in here, I mean, everybody goes, oh, we hear them pick up the clipboard twice. That's usually when they come in. And we've removed all that because they continue to get those, hey, we're on our way. And I think that's what's, and this is what we did a lot of surveys with our population out there, said, just keep me informed. And I think most people are, okay, things happen, just keep me informed. Like the airlines say, hey, your flight's been delayed. Same thing, hey, your doctor's been delayed, but we haven't forgotten about you, and we're on our way. So it just lets everybody calm down, and we've gotten great survey results from all the surveys that we've sent out.
I was just going to ask that. So how's the patient reaction been to the Jellyfish platform now that you've implemented it?
Again, I mean, you never know until you flip the light switch, right? And because you go, well, are they going to like coming in? Are they going to like giving me their phone number? Are they going to like getting text messages? Right. But it's relevant for what they're trying to accomplish. So it's like, okay, that's information I want. I want to know that my physician's running late, or I want to know my physician is running on time. Okay, I'm good with coming into the office, and now we're going to where you can just check in on your phone. You don't even have to check in on the kiosk, which is an iPad, by the way. Right. Because part of our consumers said, I don't want to touch a kiosk. I'd rather just do this on my phone. It's very personal. So that's the next benefit, that they could just check in on the phone, and the location-based services lets us know that, hey, they're here, and they just kind of come in. In the future, what we're going to do with these guys is we're going to go right on past the waiting room. You check in and you go straight into the observation room. And
zero wait.
Just zero wait. So you're not sitting out there with here's what our patients have told us, our consumers have told us is I don't want to sit in a waiting room with other sick people okay? I'm already sick or whatever. I just want to go to where I need to go to see my provider. So that's where we're headed with this.
Sounds great. Have you learned anything surprising through your interactions with St. Joseph's Cantor? I mean, in terms of anything, product ideas or enhancements or things that they pushed you to kind of add to your system?
Well, Nolan's never shy about his ideas of how we can improve the product, trust me.
That was a compliment.
That was a compliment. But probably some of the most interesting data that we gather is adoption rate even within the patient population. There's this misnomer in the market that for some reason, patients who are 65 or older, who are our highest consumers of healthcare, won't use digital technology. And then what's been great about the data is the data's shown it's absolutely false. They're actually some of our highest adopters, fastest adopters. For us guys, we're unfortunately the lower adopters. Women adopt the technology much better than we do. And that was, really kind of surprising because you do wonder sometimes, will, the elderly actually adopt this technology? And the reality is, yes, they do. And they're the highest adopters of it.
Question for you, Nolan. What's next for you in terms of what other friction points are you looking to take out? What other areas are you looking to implement the Jellyfish platform?
Well, I want to echo his sentiment about our organization, and it truly is. It's just been really kind of pushed from me, but pushed from my boss, which is COO, and then all the way to the CEO, as we look to, evolve our brand in Savannah, Georgia. We were trialing this out there at our ambulatory centers, and then we're about to open up a new, what we're calling a micro hospital. And then we're going to go into the micro hospital, and then we're going to springboard back into the rest of all of our ambulatory service centers, as well as to the two hospitals. We have two hospitals that are roughly 325 beds each. So this same technology is I think it's going to be like a fuse with gas on it as soon as we're already feeling the other ambulatory centers going, we want this technology. Because we see it as an enhancer. So it's a great day when the CIO has physicians and other service line VPs knocking on my door versus me pushing a technology towards them when they're clamoring to come towards me. I'm like, okay, if you want this, okay, here we go. And that gets the adoption.
Excellent. So let me ask a final question of you, Nolan, and I'll give it over to Dave afterwards. What's one piece of advice that you would give someone who's just starting this journey, who's just thinking about getting rid of the friction in their patient experience? What would you tell them?
I would just say, it's one of those things, in healthcare sometimes we muddle over questions for a long time, and not to sound too cliche, but just do it. Just dive in, go do it. It's the right thing to do. Look at every other service industry, like Dave said, they're already doing it. And when we go, well, maybe that works for them, but that doesn't work for us in healthcare. Yes, it does. It goes to that shifting of the mindset of start thinking of the patient as a customer, and then go find. This is shameless plugging of this guy, but go find a partner that's going to be as nimble as they are, and that's what's beautiful about their technology, that it's nimble. It's 21st century stuff. This isn't this long programming thing. Nolan, just give us what you're looking for. We'll put it in the oven and get it back to you the next day. Is that fast enough? Because we can do it. We can do it quicker, and that's because it is going to be learning, revision after revision. So that's compliments to those guys. And any customer, find someone that's going to put your name forward, because all their stuff is white labeled to us, and it's going to go. I get it. You got another revision. Okay, great. Bring it, and we'll change it for you.
Awesome.
All right,
Dave. What would the one piece of advice be? In terms of if someone comes to you and says, I would like to get started, what would you tell them?
Buy Jellyfish. Is that too easy?
I love it. That would be shameless plugging.
That would be, yeah, absolutely. No, really, I think Nolan said it best, right? It is, just jump in, right? And it is about a partnership. You have to find the right partner. Again, finding that someone who does really believe what you believe is so important to this concept. And really don't try to do it alone, right? At the end of the day, hospitals are not trained to think about consumerism, right? They're not trained to think through those processes. Even the older traditional vendors that have been in this space don't usually think about consumers, right? All of their software has been built for doctors, it's been built for nurses, it's been built for radiology techs. It hasn't necessarily been built for the consumer, the patient, right? And so it does take a different mindset, and finding that right partner, I think, is critical.
Great. Well, thank you, gentlemen. This has been fantastic to talk with you. I love this topic of patient experience. You guys are both doing amazing work. Great. So it's been a lot of fun.
Thank you
very much.
Appreciate it.
Thank you.
This has been Colin Hung with Healthcare IT Today. We just had a great conversation around patient experience with Nolan Hennessy from St. Joseph's Cantor in Savannah, Georgia, and with Dave Dial, CEO of Jellyfish Health. Thanks for watching.